So thank you very much. I'm sorry that I need to speak to you here from my office at the University of Aarhus in Denmark, and that I cannot be with you. Um, I'm a professor of political science at Aarhus University in Denmark, and I have been doing work on the pandemic. I've been leading the largest social science project on how it is that the pandemic has influenced democratic societies, both Denmark and beyond. And I've also served as an advisor to the government in different ways during the pandemic. Please, next slide. So what I'll be talking about today is the work that we have been doing on trying to understand how is it that that trust impacts pandemic response, and how is it that authorities and governments can build trust during a crisis. And of course, as we all know, one of the key solutions to the given crisis that we are in is the vaccines. And I think vaccines is or vaccine acceptance is a good place to start when thinking about the importance of trust. Next. As so what you can see here is the share of people vaccinated in the Nordic countries, and then on the bottom you can see the share of people vaccinated in the European Union and the world. And you can see that all Nordic countries are above the European Union average, and of course that has something to do with implementation and rollout of the vaccines. But just as critical is the people's trust in the vaccines and their willingness to get vaccinated. It doesn't matter that you have a whole stock of vaccines if no one are willing to take them. And in order to understand why it is that the people in the Nordic countries are willing to accept the vaccines, we should look at trust. Next slide. Next slide, please. So one of the key ways in which the Nordic countries differs from many other countries in the world is a unique high level of trust. So what you can see here is just one example of survey measures of whether people trust in other people, and you can see that so these data contains data from Sweden, Denmark, and Finland, and there is this sort of extremely high trust level compared to other countries. Next slide. What we know from the research that we've been doing is that there's a very, very tight relationship between vaccine acceptance in countries and the trust in society. So the relationship is almost perfect, that those countries who have higher trust, specifically in the health authorities, they are also more willing to get vaccinated. And of course, the reason why is that many people do not know why it is that the vaccines work. They don't know how vaccines are approved, and therefore trust is key. If you do not trust the authorities when they say that the vaccines are efficient and secure, then you are not likely to get vaccinated. So it's key to uphold trust. Next slide. And the question then, of course, is how to do so. And what I'll share with you are 3 insights from the research we've been doing about how you uphold trust in a crisis. And the first one is that you should foster competence among your citizens. Next slide. When the pandemic okay, so what you should have seen on the bottom is a number of flags rather than gibberish. Um, I don't know how that happened in the translation of the slides. But in any case, what we did when the pandemic hit the world in March 2020 was that we fielded studies in 8 different countries, 2 Nordic countries, Denmark and Sweden, and then a number of other Western democracies. And what we were interested in was, well, who changed behavior in this sort of crisis moment. Next slide. And so what you may think as an authority or as a government is that the key thing is to create fear. People need to be afraid if they are to change their behavior when a crisis emerges. And we do find that people who are more afraid, that they have changed their behavior more. But the most important factor, according to the studies we have been doing, is actually not fear, but but what we call the sense of self-efficacy, which is the feeling that you know what to do and that you feel capable of doing it. So essentially, when the pandemic hit, people they said, "Well, tell us what to do, and we'll do it," independently of whether they were personally afraid or not. Uh, th- what we also find in our research is that this sense of self-efficacy and knowledge that also generates support for the pandemic response in the given country. So this is a way to build trust. And when authorities communicate, they should focus not just on creating concern, but very much on creating this sense of competence, telling people what to do, and enabling them to feel that they can deal with the crisis. Next slide. The next key finding of our research is the role of transparency in communication. Next slide. So many of you will probably remember in March 2021, there was a lot of focus on the AstraZeneca vaccine and potential side effects related to blood clots. And some of the Nordic countries pulled out the AstraZeneca vaccine altogether from their vaccination programs. And one concern that of course was aired at the time is, well, is this focus on the side effects of a vaccine, is that creating a vaccine hesitancy? Next slide. But at the same time, it's important to realize that the alternative communication strategy to this sort of transparency about negative features of the vaccine may actually be worse. If we look at the relationship between doctors and patients, then we often see that what doctors resort to is what you call vague reassurances, which is to say, well, don't worry about it, it's all fine. And what we find, or what the research on this kind of health communication strategy shows, is that that creates uncertainty. When people get these vague assurances, it elicits uncertainties. And what we know from the psychological literature is that feelings of uncertainty is one of the primary psychological predictors of beliefs in, for example, conspiracy theories, and decreases in trust. Next slide. So what we have been doing in our research is to look specifically at this in the context of vaccine communication. So what we did was that we had a study where more than, or almost 7,000 Danes and Americans participated. In this study, they received information about a fictitious new COVID vaccine that we called Covaxit, and they got information about its effectiveness and its side effects. But different groups received different information about this fictitious vaccine. So some people got very transparent information about, so this is what we know about the effectiveness, this is what we know about the side effects. And some of the groups even got negative information where it was sort of transparently laid out, say, well, this is the level of effectiveness, and that's actually worse than what we would expect on the basis of flu vaccines, for example. And also, this is the type of side effects that it generates. And again, this is worse than we would expect. One other group got what we call vague reassuring communication, where it say, well, it's safe enough, it's effective enough, don't worry about it, it's all good. And what we find is that both this sort of transparent negative communication and the vague reassuring communication reduces vaccine acceptance. So people are not very eager to take a bad vaccine, which is not surprising. But what is interesting is that they are also not very eager to take a vaccine that have been promoted in this vague way. Uh, Furthermore, what we find is that the transparent negative communication actually increases trust in the authorities in the center of the communication, whereas the vague, reassuring communication reduces trust. Next slide. Uh, so, what this means is that essentially, while when you when you communicate about negative things in a transparent way, that may create short-term problems, but it's really key to uphold this long-term resource of trust, and therefore our advice have been continuously been focus on radical transparency, lay out all the facts on the table, even the complicated ones and the unpleasant ones. The final thing that I'll talk about in with regards to how to uphold trust is about buffering fatigue, and this is where we come very close to the topic of mental health. Next slide, please. So what you see here is data that we have been collecting for these 8 countries that we have been following through the pandemic, or at least from March 2020 until July 2021. And you can see the countries here. It's Denmark, Sweden, the UK, the US, Italy, France, Germany, and Hungary. What you can see in the graph itself is the proportion in each country that supports the government's COVID-19 policies. And what we can see is that it starts high in many countries, and then support decreases as the crisis unfolds and as time goes by. And in the more complicated statistical analysis that we have made, we can actually see that times plays a role in itself. That as time goes by, people become less supportive of what happens. And one of the reasons is fatigue. Please, next slide. So one of the main challenges of pandemic management is that the restrictions they have multiple costs. So what you see here on the right side of the slide is a table from a report that an advisory group that I'm part of did to the Danish government about how to reopen society in 2021 in the winter. And what we were looking at there is, so what are the benefits of restrictions? And of course, the benefits of restrictions is that they control infection spread. But we also looked at the dimensions of cost on it and say, well, there's for sure economic costs, but there are also costs in terms of mental health, and there are costs in terms of individual freedom. And as these costs accumulates, then support begins to become lower. What we also find in our research is that what is especially important for people when they evaluate restrictions is these mental health costs. So the mental health impact on yourself is what generates opposition towards restrictions. Next slide. So in our research, we have been trying to follow this more directly by actually measuring feelings of pandemic fatigue. So the sense that you cannot keep up with restrictions any longer. And here you can see the unfolding of pandemic fatigue in the 8 countries. Overall, what you can see is that depending on the country and the time of the pandemic, between 10 to 40% of the population have been feeling fatigued. And fatigue is especially high in countries such as Italy and France that have had more severe measures. What you see on the left side of the slide is the sort of statistical results in what it drives pandemic fatigue over time. And one thing is, of course, restrictions. So as when restrictions are tightened, pandemic fatigue goes up. We also see that time matters. So a specific level of restriction will create more fatigue later on in the pandemic than earlier on, which also means that restrictions at this time where we are now will actually generate quite a bit of fatigue. But finally, we're also seeing an interesting other thing, which is that as the number of deaths from COVID increases, then actually fatigue decreases. So when people can see that we are in a severe situation, then it feels less bad to live under restrictions. So when you can see the meaning of the suffering that you have, then you are more willing to accept it. So that also shows something about how it is important to uphold trust and uphold the legitimacy of the restrictions in order to buffer fatigue. So next slide, please. When we look at the psychological effects of fatigue, then it has a very wide range of effects. So we can see that people who feel fatigued and become more fatigued, that lowers the trust in the government, it lowers trust in the pandemic management, it increases beliefs in conspiracy theories, and it also increases support for public protest. Next slide. In some of the research that we have been doing on pandemic fatigue, we have also looked at more extreme responses, you could say, such as support for political violence and engagement in acts of political violence. And this is something that we have seen across the world. Current estimates says that demonstrations worldwide increased around 7% during 2020, with many of them being directed at pandemic restrictions. And what we can see is that this feeling of fatigue, this sort of perfect storm of stresses that a pandemic is, creates these true radicalization processes, which also means that societies that have experienced high levels of fatigue will most likely have radicalized groups in its midst that will continue to exist and continue to create problems beyond the pandemic. So we have already seen pandemic-specific terrorist plots being unraveled in, for example, Italy. So what is key from this perspective is to buffer fatigue through relief packages, through interventions at risk groups, but also by creating legitimacy and upholding trust such that people can see the meaning of their suffering. Next slide. So what I'll try to do now is to sort of sum up the key lessons and take them one sort of a slight bit further. And I think the first lesson, and that's on the next slide, please, is essentially for authorities and governments to trust your citizens in a crisis like that. So if you do not trust your citizens, then you will often sort of, for example, fear panic. They say, well, I cannot really tell what goes on because people will panic. That was the strategy chosen by Donald Trump, for example, who intentionally played down the risk of COVID to avoid this idea of panic. But the problem is that if you fear a panic-prone public, then you will often react with too little communication and too little restrictions, and that will increase infection spread. Luckily, we also know from research that this idea of the panic-prone public is wrong. People do not react with panic in crisis situations. They most often react with solidarity. But you can also do too much because you fear the public. So if you fear that the public will not comply with your restrictions, then you may shift towards more aggressive restrictions, such as actual curfews that we have seen, for example, in France. What we know is that those kind of very aggressive restrictions, they will create this sort of vicious circle of lowering trust and creating decreasing compliance even more, which will then necessitate even stronger restrictions. So the first crucial thing is to trust your citizens, trust them with the truth, even if it's unpleasant and even if it's complicated. Next slide. So what you see on this slide is some of the data work that we have been doing on a weekly basis since March 2020, and have sent in to both authorities, governments, and the media and the general public, sort of basically giving a sense of what are people doing now, what are they feeling, what are their concerns. And I think one key lesson, at least from us and the project that I've been leading during the pandemic, is that it's key to use social science in a crisis like this. A pandemic is not just a health crisis; it's a total crisis, and we need to look at the entire crisis, including how it impacts attitudes, feelings of trust, legitimacy, and mental health. And I think the optimal way to think about a pandemic response and is as a co-production between authorities and citizens. Next slide. So essentially, the way we should think about it is that authorities, they provide advice, they determine restrictions that then affects the citizens. But at the same time, what authorities should do is that they should continuously monitor citizens' compliance through these social science methods in order to make sure that the restrictions that they impose, that they are balanced, that they are not too little or not too much. But they should also constantly monitor the costs of the pandemic and the associated restrictions. So what are the troubles with mental health? How are people afraid of the democratic rights? Are they afraid of the economic consequences? And in this way, using social science methods such as surveys, focus groups, or deliberative bodies, then you can sort of give people a voice, and authorities can react when they can see that the cost becomes too high and that they're losing legitimacy. So essentially, what authorities should do in order to uphold trust is to think of citizens as active co-players in the pandemic response, rather than as someone who creates problems. And with that, let's go to the final slide, and then I want to say thank you very much for your attention.
Thank you so much. Thank you so much, and thanks to all the presenters. And Michael, can you stay with us also for discussions? I would like to ask all the presenters to be there for discussions now. We have the two of you in Helsinki, and then you can both ask questions in the room, and there's people who will help you with microphones. But I will start because here online, there's one question for Michael. Are you collecting data on trust in other people? It would be interesting to see how trust in others was impacted by COVID, particularly in countries where restrictions were first rather lax, for example, in Sweden. Michael, can you answer that?
I very much can, and the short answer is yes. We have collected a lot of data on trust in others, and I think one of the coming weeks we will put out a so-called preprint with our findings. And essentially, what we are finding using data from, so this is from Denmark and United States and Hungary and Italy, not Sweden, but there we're finding that what the pandemic does is that it decreases substantially trust in the political system, but it actually does not decrease trust in others. So it seems that the impact, the disruptive impact of the pandemic is mostly in the what you can call vertical relationship between citizens and the state, and not so much in the horizontal relationships between citizens.
Can I just follow up on that? Because I looked at trust after the collapse of the banking system. Of course, the trust towards the banking system and some authorities collapsed. While have you any comparison with other like crisis? Might be, of course, the trust is not the same. If you lose trust in one, it doesn't mean that you lose trust in other. But Have you compared this to other crises?
We don't have direct comparisons, but I think that is important, and I should say that I think that the troubles or the risk of losing trust in each other is not over yet. I think that especially some of the discussions that are happening all over Europe about the distinction between vaccinated and unvaccinated will most likely tap into or could potentially decrease trust between people.
Yeah. Thank you. Yeah.
I have a question for Frederick, but just one for Michael first, and if I have time, then one for Frederick. This is more out of curiosity, Michael, but do you think, how does trust work in more authoritarian countries? There's been a lot of interest in them during the pandemic, not just really authoritarian countries like China, but also places like Singapore, for instance. And I wonder, have you done anything that reflects, for instance, on the difference between, China, for instance, and Russia, where there's a lot of resistance and vaccine hesitancy there, for instance, but yet in China it seems to be quite different. Is there anything about the importance of trust, or is trust important in more authoritarian systems, or is it just something that's really important in more democratic systems? So that's that question for Michael.
You can ask the question for Frederick also. Oh, sorry. Oh, Michael, just keep the microphone. Michael.
Oh, yes. No, this is a very, very important question, and I don't have sort of firm evidence, but I can give you my hunches, and I think that there's so we have focused on democratic societies in the research we've been doing, but there is research that have looked at trust more generally and found that trust is important, and I think that there are a difference between the authoritarian countries related to the Soviet Union and then the Asian authoritarian countries. And I think that there are two factors. One is that it does seem as if, for example, the Chinese have higher levels of trust than the Russians. But also they had the experience of SARS and MERS, which I think created a huge motivation to react swiftly when COVID came along.
Thanks. And David, you had a question for. Thank you, Michael. You had a question for Frederick as well, didn't you?
Yeah, and it's kind of, in some ways, well, not similar, but it's also about the democratic process in a sense. And when you're talking about sustainable well-being in cities, I mean, I would have thought the democratic process is actually probably more vibrant in cities than it is at a national level, and more complex. And what do you do, or how do you think about engaging with the democratic process in order to have sustainability when presumably there's a lot of turnover in political structures, political ideas at a city level? Thank you.
Well, that probably also should be asked to the professor in political science even more than, but in terms of practicing work in relation to political developments, one of the things we have been doing a lot is to try to broker linkages, for example, between civil society and political decision making in a stronger way. One example I can mention is one of the areas of Stockholm which is the most economically most empowered. We've been very cautious to run meetings with politicians there and making sure that it becomes a place and a relationship where that voice is heard very much through, and also allowing them to express from all kinds of different views, not structuring. I mean, the work we're doing out there, for example, is based on what we saw there was that they had felt that the requirements for funding of different work around youth in that particular had to be obeying to particular formatting around public health, which wasn't at all relevant to how the youth were understanding their own. They had a really sophisticated, systematic or systems view of what mattered in terms of experiences of discrimination and housing and what have you, voice and less voice and low trust in authorities or whatever. So it's been a lot of strengthening those kinds of relationships. Over time, what you can think, I find there are two elements, and I'll add one respecting this. One thing that you were pointing on, Michael, here is the perceived need to be infallible as a government. And that's actually what's behind the Steering 2020 idea and the humble governance model, where in more high trust societies, maybe you can strike some thin consensus over time between different political parties. We do that in investing in roads and investing in infrastructure or other kinds of ways. So there's an opportunity to do it. So I think the balances of, in terms of the political systems, how do you make sure you have long-term commitments across the board, but also allowing for political day-to-day conversations within that framework? I think we've sometimes thought that we should not get political involvement actively around mental health and well-being. We should make, funding coming out and so on. But I think we should have the dynamic, vibrant political debate about mental health promotion. If we can get there, that will be, making the interests of politicians to learn more. Also, what we've done a lot is to have the opportunity to spend time to really work with knowledge development around politicians. It's been absolutely essential, and used actually other countries' ex-politicians as an help, which we can do a lot more in the Nordics, because if they're outside of the country, they can talk about the issues without being connected to a particular party, and particularly if they're out of the political game. So we, for example, in our advisory board for the strategy in Region of Stockholm, we had Paul Burstow, who was previously a Liberal Democrat, and also therefore not signed in a very particular kind of polarized party connection in some way, helping the Swedish politicians to think through how these issues could work politically. So I led many of those learning sessions. So those are one of the ways, and actually I could say we're probably more successful in developing the political process capabilities than the internal. That's what I ended with, the need to invest in building capability and new ways of working in the administrations, because the administration might not have developed as fast as the political expectation. Maybe it was a bit of an answer.
Yeah, but thank you. The session is about the post-pandemic mental health promotion, and we have now some questions for Rosa as well. So I don't know if you see them, so I'll just read them out. Rosa, is there other initiative currently taking place at country level that are promoting the use of arts or creativity to cope with the aftermath of the pandemic, or with the objective of building resilience in the population? And there's another question, it's similar, going to the need for a personal relationship with art. How do you see building that relationship with traditional forms of culture, museums, theaters, in the post-COVID world?
For the first question, no, we don't have really any governmental program for that, but it's I think which would be the most important thing is to promote in the city and communal level the community building. It's something we need after pandemic, and do it with a holistic way. To of course culture and arts must be related, because libraries and city festivals and something like that are wonderful tools for community building. People really find a way to participate, and it feels good. But I think the community building is not right now the superpower of Finland, even though we have a wonderful background in activism and doing things together and voluntary work. But right now, I think we are in a phase we need new ways to do the community building, and I want that culture and art can help. But right now, I think we are too much in Finnish cultural politics. We also in the cultural field are too much in our own bubble, and that's one reason I'm so happy that you invited me here. and we can learn things what to do together. And what? Sorry, Dora, what was the other question about theaters and so on? I totally forgot.
How do you see building that relationship with traditional forms of cultures, museums, theaters in the post-COVID world? So how do you see any recommendation? How should that be? The personal relationship with art. How do you see building that relationship with traditional forms of culture? Do you have any ideas?
Yes. I'm not sure about the whole Nordic situation, but using Finland as an example, our theaters and museums and orchestras most of them are owned or run by commune, a city. So it's kind of really local politics. And maybe the tradition has been that, well, cities has been satisfied if there's enough audience, and they haven't really focused on who are in the audience. Is this equal? Is this accessible really to all? Is this something which is relevant for all? And this is something we really must concentrate into because we know that people who are sick and poor are not building the strong majority of our audiences. And we want to do more. For example, in the city of Tampere, which is the best city in the world, there has been a wonderful project with museums to find paths for those immigrant mothers who are not part of workforce, doesn't study or go to work. So they are using museum as a tool to help them to participate in the community, to understand the country that they live in. And because every city has a wonderful museum collections about local history and also kind of what's the point of it on a society. So I really recommend that these kind of equality and accessible
reach out to those who are not using the museum theaters, and we maybe what you're saying, that we need special programs.
We have to do more.
Yeah, thank you. Just because we're running out of time, there's one more question. Thank you so much, Rosa. There's a question for Michael. I wonder what is the importance for the way how the message is told? If the authority is very confident, does it influence better to the trust regardless of the message? Do you have a short answer to that one? Because we have 2 minutes left.
Yes, I can try to make it short, although it's a complicated question. But I think it's extremely important to be extremely transparent about the complexities and the dilemmas and difficulties underlying the message. But at the same time, you need, when you lead during a crisis, you need to be unambiguous about what the advice is. So that's not the same as confidence, but that's that you need to say, well, on the basis of all this complexity, which we acknowledge, then this is our advice to you. So I think you shouldn't necessarily think in terms of confidence, but more in being clear about the advice, but at the same time acknowledge the involved uncertainties. And that's not easy, but that's the task essentially.
Thank you so much, and thank you to all the presenters. Are there any last questions from the room before I make like a roundup because you need a break as well? That they are important, especially when you are there and you have the chance to discuss with other people.
The only comment I want to make is the common thread around how mental health promotion also crucially is part of creating our democratic societies. And I think that we have to use the tools to get to that through arts, through other things. And that could then create community that will then build trust both between us and in relation to our governments. And the governments have to own that trust in terms of through the way they're working. So just a bit of a attempt to draw some things together.
Yeah,
thank you.
Yeah, thank you for that, and I agree with you. I think we take also the message from this morning. I mean, there are no quick fix solutions, and we can't. Youth is not just one voice, and we need to listen to different voices, and maybe we can also listening to all of you and from this morning, there is this opportunity in this crisis. I think politicians haven't been very interested in mental health, but I think they may be more interested, and that we have put mental health and well-being. I mean, that's so important, and we have that's so much more discussion. I think we brought it up to the table, the importance of the well-being for all. So I think there's an opportunity there as well, and also maybe using the same like evidence-based practices that we're using dealing with COVID. How do we use also the evidence-based programs and implement them as well for mental health promotion in the community, creating well-being for all. Thank you so much to all of you. Thank you, Fredrik, Rosa, and Michael. And I really would love to be there and discuss this further with you. Hope you will in the coffee break. Enjoy the rest of the day. Thank you so much.
Thank you, Dora.
Thank you.
Thank you.